How many times and how often do you go on regular checkups? Me say, and predator said, "Was sorry, I exercise. This press up. You wait me, I be that." Hospital a atwa Ghana afanane ne monchia so da biara dan wako bi da na. Me say enne ye baba bedi apomuden ho enkomo. Me say enne ye baba bedi apomuden ho enkomo. And I have a lovely guest in our studio today. Me say, mami keeping suspense answer. It's answer about and ho fe your fan info padia, your fan head tips and casa padia. Me say, wunya ne baby I just say abayo way as here because what's in a juma say
DJ Shout. So me pesa me de wo before be me mu. Treat me like a ballet.
all right, treat me like your brother. And until me treat you as a brother and as a sister. Until and then me de head tips no air bro. Me dwene wo ho me say me do what me dwene wo ho me sound so do until info bu o ma minti me emfa nya dai emfancy you. Until no me say your guest and I is seated. She is already seated in our studio. Until the piano na ya den ye din komo. Head tips on the street. Your guest na I is seated in our studio. Until no yam piano na yeni ni enidi in komo. We say seat na ya de. Seat na ya de. What na say? Hey, abaya we be hu na me feel keke. Seat na ya de. Welcome once again in our studio of Media 9 Network. Let's say ɛhyɛ yie paa ohwɛ de wi a mesi so ɛte yie a na ɛsɛ ahoɔden ni hɔ man ka mintimi bɛtena ase nti no ɛhyɛ yie me ho ɔden ɔmpaebɔ ɛne ɔhead tips always bi adema me adawoma nti no me gyina so brane ma ayɛ sɛ ɔsono no ɛhyi biribi adamu kama paa na nnɛ no nkɔmmɔ no STD yɛhu sɛ ɛnɛ mmerante aba ɔmo ntimi nkata ɔmo zip so saa nso na ɛmaayewa no nso ɛkyɛ sɛ skinny ɛne skirt yi sɛ eyi wɔn nan koko mu ani nti mmeranteɛ no so fra na ɛforo ɛna wɔn so tia na ɛte yareɛ no nti STD ɛnɛ mebɔ bi ɛwɔ studio ha ɛna abaayewa bi ɛbɔ pin me na mehwɛ deɛ ɔyɛ ne ho no deɛ ɔyɛ ne ho a otumi sɛ wate biribi onya biribi anka ɔbɛka nanso no pɛpɛ sɛ ɔka ɛde ma me STD ɛne deɛ bɛyɛ.
Okay, so Najim, that's it. If we should say STIs, they are infections that spread primarily to persons when they have sexual contact, and these transmissions are made possible by virus, bacteria, and sometimes parasites. And even though it's a burden to the whole world, but studies say developing countries like our country here, Ghana, we experience that epidemic more. So that's the brief thing I can say about the STIs for now.
Na me ka STD ene me hu se woti wadwuma ase ntino wo keka STI. Is there any difference between STI and STD ana?
Yeah, there is a slight difference, but not a wider one.
Nti STD ne de hin na STI no so ne de hin. Ana ni nyina de kro na.
STI, as the name goes, is infection, and STD is the disease. So the infection can lead to the disease if not treated.
Na say STD no aye de hin. Eno ni disease no.
One, yeah, one.
And STI no enso ye de be infection no.
Yeah, you have the infection, so you can do something about it. But when it gets to the disease stage, no, that means a cough, yeah.
As odi kanya infection no, that's when treat ya. And a baby disease, no?
Exactly.
Nice one there. In this case, no, let us know some of the diseases and as infections. Let's start off with the infections. Cause these diseases, no.
Okay. So then be kind, these infections or transmissions are made possible some by virus, some by bacteria, some by fungi, and some by parasites. It's CFR virus now be a HIV, and with the virus now, yes, our genital herpes, and our human papilloma virus, which is HPV, and our bacteria, and yes, our bacteria. And so, remember examples of bacteria be a chlamydia, gonorrhea, and a syphilis, and a fungi, and so our candidiasis, and a trichomoniasis. And see, that's the
Enti no say me twa enkomo no so dia sweet na ya date. Maybe say how often and I was say obi etimi call hospital and I say any clinic for this checkup money who say when ya STD ni bi and I say what one ma otwen ya na say ba no call for treatment.
Oh, actually, in the gynecological aspect, no, women there obetumi call for way pap smear test, and a woman obetumi call for checkups, but
We see women on betimi call for the pap
pap
there.
smear,
Pap
pap
there.
smear, pap smear,
Pap smear.
yeah.
I know if say pap be at it. I watch you ya na
Oh, the checkup, yeah, the cervix, yeah, yeah, court way, yeah, the speculum. Nigeria me cover.
I was saying no cover because who kaka
Yeah,
speculum no
no
cram
be.
tia cram ntia se na ma bere wa wati fie
Okay.
me so say salon so show me chiri mu na me ntia se speculum ni
Okay,
ade
just to
Mhm.
give way to proper vision of the cervix. Now you're taking sample from the near test to say, oh, or something like cervical cancer or other stuff. Yeah, it's a pap smear is an example of the test. Yeah. And aside that, no, wow, how bit me I go for checkups, even though a bit we are not used to that. Yeah, in town, I just say when you have symptoms, yeah, but Becky can and I see
so o ka symptoms ho asem de ene ma me fa wura this angle na me bisa o say STDs na say STIs ni nyina na wunya utimi these symptoms ma wo hu say wonya sa yare na
yeah, obenya symptoms. Even though it be a honoma, emba outward signs, but inward. But even though still na symptoms because ebema we feeling something within.
te emudi ehin na
anything
wunya symptoms no so still na betimi a hurt wa na say betimi abre
Actually,
emudi ehin na say wunya and show
Wunya,
any
won't show
symptoms so
symptoms.
still na
Yeah.
you see say wo
something like the hepatitis B. And you say about study says about 50% of people do not get the outward signs. In talk outward signs, I mean you say inward signs, no, you're gonna see it or obe feel it something like nausea and vomiting. Obey means when your joint pains. But something like rashes, nomne, itching now obenya outwardly when compared to other infections, many are quite different.
okay in this case you know can there be a situation whereby I'll get myself treated after getting any STDs now at the end of the day and still now make me a sansonia infection ni bi man
And again,
say menya bi ma call for treatment into me fin say eno anu no ma she bulletproof bi aye okay ma no madura ma ma strong me san so eje bi mu a make me a sansonia infection ni bi
yeah, exactly. Say, in fact, say, our partner, not say, one mouth infection. So then, boy, whether viral, whether bacterial, or whether fungal infection. That's a word treating, that's our partner in treaty. Once you have sexual intercourse with your partner, no, there is the highest possibility, say, said to me, especially females, cry.
na obi bisa that question we say nti ma me fa enwo eto emfama no nipa ko no e bisa say wa oba ni din dia me de beta kakra we bisa say the kind of color say be a free na ya say eba no different nti could it be say when ya any STD ana
No, so na yes. So, Sabina say, yes.
okay
Okay. Different. I have far be to say candidates is that a lot of women this word is not new to them. Candidiasis. Dodona friend of white. It's a whitish discharge. I know na omunya obeka say when you're white. And the other form so I don't see a vaginitis infection ibisa and your friend of trichomoniasis and also a greenish yellowish and sometimes frothy. Because it be a frothy, that means I say bubbles bisa as a bubbles be ni any friend of frothy way no. That discharge in either yellowish, greenish yellowish, and as a whitish no. That means there is an infection. And under normal even though women what discharges, but it shouldn't be smelly and I say different from the normal thing now you deviant. So if there is anything different, that means there is a deviation. So she should seek medical attention.
now okay obi so air to aya pia wa hike cancer bi say wa no de say ne ye ka say sexually transmitted disease one day unko have sex But in this case, obe have this what people are now saying them for the kind of oral sex. It's still now with this person having the oral sex, bit many this STDs.
Oh yeah.
On the one day and so enter one coin. Maybe and so one day or corny did that false mommy. Into one so bit many STD medium now possible.
Yes, Najo, bit me.
How possible?
Because oral sex, you see, using the using the mouth for sex instead of the usual way, if I can't be an
in simple one master open so kata so be near the mentia you was using the mouth and I said the bend
yeah,
see the oral
so oral means they use
kasa mean kasa say bema now so kasa mama say bema na menti won kan na obi so
oti I make Kenya
but
say me wo
for how wonim the dam animu a o de wonim ntira
yanko we dey maybe be some
Matia how there was some
oral sex now obisa that means nipa chrono or yeah people call it BJ also. So and also no bit me infection as we said that because nipa chrono when ya be to say chlamydia, gonorrhea, syphilis and ample candida na nipa chrono because or then no maybe because of the source as a sign and symptom for those infection me boy obetumi atake bacteria from there nti obetumi out way and I even cross when ya cat na so wo HIV a nipa kro no so obetumi asake blood no and virus na ebe koni then it starts operating
you know omo ho say Roman father na kife sem no ye the oral sex na ye okwetena so dem na okura mic no ye be yi wa ye hwanhwani so oral sex no ye no meaning say possibility ni so betime nya STD no eh stronger pa.
Yeah, possibility doesn't mean say because obin so preference no.
Okay, the preference no still no betime ate
so it's like the normal way of sexual intercourse no. It's say way no
so what Daniel Chiro say will be inside we still now betime anya.
Yeah, so
and
you
in this
just
case mama sound so emisa of this question because who hear me obitimi na adwen say always be I will be on pills and also on drugs. That person a bit more protecting from STDs.
No.
Now, a bad thing because they be a drone no guso no.
A drone no or they prevent pregnancy. And pregnancy is not with infection.
And so one so a white a dray been a definite they be a one.
So white and some kwanye way infection. White and some kwanye way STI. See fine no white a draw. What of HIV? What of gonorrhea? What of syphilis? What of chlamydia? What of trichomoniasis? And the
trichomoniasis no so there.
And they can explain it say ni candida no. But no the difference between candida and say no yeah candida is whitish discharge and trichomoniasis is greenish yellowish discharge.
Hey. Oh guys. They say oh guys common mo aye there emu aye hwa me say we problem a o facing wo fie no o how a da wo so e wo fie no fa message ne efa for ho no ma me na me ne wonya dai yemmisa anti nurse na ya date yenya ne hai yemmisa na yentimi emnye ye answers to our problems so wo any STD you person who the symptoms and whatever na yemmisa no number no 0244355496 for message ne fa for no ma WhatsApp Facebook nso live no ho no ma me kan asan so e dia ma na in this case no na ya date obi nso ebisa se one na kodonkua bi ana say ye fan say wo mo we won ho if they are having sex or Philippine does it mean say when you STD?
Yeah, it's possible because me can't wait now. Mama fa we some fan can't wait signs and symptoms no. Signs and symptoms you go out do be do na almost 90% of the infections no ubenya itching and soreness of the mouth and sometimes the genital areas and ubenya way this perineum. You said synergy.
Maybe there was mom. What there was?
Okay, and ubenya way. A man a bit me swollen testicles and obet me bleeding during or after sex and some also they when treating in term it can lead to precancerous cells in the cervix. To say we HPV no, and I say cauliflower. Na your friend no genital warts. Another name for HPV is genital warts. So a bear say cauliflower na are forming on the way, genital area. Hence, when treating in tema, a bit to me, lead to cancer of the cervix. So,
and moving forward, obi me per se auto boise na which say signs and symptoms in muji. Now before say we move on to that, obi kase ya na wo hu some bombs bi ase insansan bi awa na yas no do susu se ebia wayi ho na ama sansan na egu ho nom na ebetima ye eno a anase STDs ni bi no etimi resulting in that.
Yeah, STDs may be result in that, like the genital herpes, no, and when for me to say blister, me come blister, I say it shins you. Yeah, so during
you na blister no.
Yeah.
Was why. Maybe yeah was.
It as during sexual intercourse, no, a bit to me a bestie. It's a bestie a becca the other part no, a casket no so a bit to me. Ama I say a pompa say a be a pie kwa baby for bit me access on hand here free pass none honor. Now say it's only be a count when a man also when those blisters maybe. So those blisters on the genital area no. And so a friend of genital herpes. But aside that in your wall, say sometimes when people shave or munya that way no. And san
okay.
And so notice difference no.
Ntenye nsan bia na ye CD. Nsan bi ho ma na say enwi na wayi no. E ho na wo clear bush no. Entia.
And a genital herpes no cry. Aya blister form no. Esa we esa ye itchy. Aya be keka.
Na say na ehene.
Yeah.
Na say wuyi dia na no na ehene.
Yeah.
Na de no no ye infection si de no nya hene.
There be nyesa we ya ne nyina betimi aye hene, but the more na wo titi no na e shins you.
Okay.
I don't know say to that kind na normal way. Genital herpes e betimi say go ano ne ayi no. Na aye se nya ho no. Eti e shins you sa na the more na e shins you na say ye ohene nti wo titi no na e best. Two titi na nsuo no go ha na e say multiply.
All right, in this case no, some people see gonorrhea and syphilis say the same thing. It mean the same thing, and I say, are they having the same symptoms in terms of say unya the abeja no symptoms no gonorrhea ni nyina yepe?
Ni afo.
Meaning say the same thing and the symptoms no gonorrhea need to send a syphilis there so to say.
Nyina almost the same symptoms. And even way chlamydia. Nyina itching, swollen testicles. Or bleeding during and after sex, and now or dysuria, that means painful urination, dyspareunia, painful sexual intercourse, and rectal pain. So when it mean your crow, so in the words anus and on in the throat and in the lips. But there I thought I almost differentiated the syphilis. Yes, the syphilis comes with the sore throat, no, but gonorrhea doesn't. Comes with that.
And in this case, you say you the STDs, aside gono and syphilis, some other STDs, maybe this hepatitis B, near the now they can make the mention of this, and also symptoms. Yeah, to say.
Okay, to say hepatitis B, and I mentioned joint pain, and hepatitis B in the crowd.
There's a picture you are watching, syphilis edia no the we are yase ne wo niema bi wase ebesi aye wo no mema ne de na da ho no utimu sa me sirawo se wo didi dia na da de wo de a che yen that esan se wo si yeji na wo hu se wo fall victim of san nemo ya no hu de we a esitie na ansa na obekọ hepatitis B dia no so no pese mbisa se ebinom obi wo ma na insansa na etimi gu na chi obi de ne na ase still na etimi egu no anasa syphilis anan de egu ya yase nko a obi dia egu nechi
and see on say bibia was stages and see when treat here na multiply
obi dia na egu nechi egu one ma say as a horror movie be a makeup obi so dia na nase e na da so no nice one there. Yeah, okay, continue for me.
And see when treat here na multiply na e lead to other way.
Okay, any other boko hepatitis B no so na ye
hu hepatitis B no as I was saying and also ebema joint pain.
Okay.
And this symptom e be so omani and almost skin to me yellowish even though rare enyo obi ana obetenya. percentage wise no omo nya sa yellow eyes and skin no when they get hepatitis B no ɛwɔ form. And I mentioned earlier say almost 50% omunya no outward signs. Inti bibia amba to sense outwardly everything is within into your joints. Nah, you'll be nosy. You feel like vomiting. And your fat way na genital herpes na me kind na
genital herpes. Is it the same as genital warts?
Partial therapy.
I know she a different thing.
Yeah, genital herpes na me cause ebe form a blister ebe shishin nsuo. But genital warts no. And only there no ɛbɛyɛ hard ɛno ɛɛden ɛnhyɛ nsuo but ɛbɛyɛ prekesɛn te sɛ cauliflower. Yeah, I hope so be projected pic no ama yɛahwɛ ɛbɛyɛ bibi te sɛ cauliflower prekesɛn bi na ɛgu genital area hɔ no and the difference ɛwɔ mu ne sɛ wei no ɛform a blister na wei no yɛ hard.
And there is this disease ɔmo fɛ no ɛyɛ ɔsɛ deɛ bɛyin PLD, that is pelvic inflammatory disease. And also PID.
Yeah.
I say pelvic.
Yeah.
PID.
Yeah. Pelvic inflammatory disease.
And also a disease bear.
And also I say a secondary to these infections no often so when treated here. Said the a bit me leading to cancers no. They said the genital warts no when treated bit me amoenya cervical cancer no. Sounds also na say other way infections no when you tell bit me any way pelvic inflammatory diseases.
Scabbles also no see there be disease no.
Yeah, can
so scabbles so say there no see there.
Scabbles.
O there to aso e wo ho no mam na obi na so ye there no so
talking about continue with
the PLD no.
PID.
Asemo yanko.
PID yeah. I know as the name goes no pelvic inflammatory disease no disease that happen to the pelvis mostly gynecological no vaginitis that means inflammation of the vagina and the way cervical cancer more into anything way concerning the pelvis no it's infections to those areas.
All right, now yeah, it was on yeah wrap up crack free show no so no. We just want to know hepatitis B. The other time it is said no will be can one say and yes sex and so be tinte so crack to and I said whom feel quite make can ultimately be possible sir.
Yeah, fluid transmission, even blood. Yeah. And I even obi sabi obi ajanai. Yeah. And once nurse soon as or be able to any animal and say obi enya bi na say or call private na say obi eden ho ko kana say or the ba able to any animal so betimi enya bi sa.
Okay, now let's move on to some of the risk factors. And nearma will be yeah obvious say betimi ama na enya this STDs no aside say or having sex in one. Are there any other ways betimi causes some risk factors in terms of being STDs?
And so they all kind blood transfusion because so they account of sexually transmitted infection 90% say sex.
Okay.
Now they can oral sex and they were unprotected sex and they were multiple sexual partners and having sex with an infected person. I'm sure say
you be project this picture and also the account you know. If you say when to me I'm a born near man you also read for yourself and you get to know some of the things I was yeah bet me I'm when you the STDs no to us mommy.
Okay. Said the other kind mostly sex into na it didn't require sexually transmitted infection. Into the other way you'll be betting me one not sexually active. Say via onya way blood transfusion with obia why infected.
And you know, finally, no, yes, your final words now. Medical, I'm out there. What country? What are some of the preventive measures I was here first now?
Okay, see. Yeah, babe, yeah, they be a done it cause nah. Because instead of make how protected sex, no, you should have protected sex. And nobody's me used to they see away, you know, family planning, no. We talked about condom as a dual protection. So, you know, it's me preventing pregnancy and at the same time, you know, it's me preventing infection. And so you can have protected sex. And you shouldn't have multiple partners. Mo be ambo mi o.
Na say enyo ho ne entity so. Okay. E dey bi o dey to asoma.
And you should make sure say your partner is free of infection. Yeah.
Ansa na no na be bi an na do be dey no ba dey okay mate.
Yeah, no.
Eno ne answers to the gods and as a question to the gods it mate o dey just your final words na
and
sorry.
even we omoka moye we no. Monogamy now I'm free say they are with only one partner no. At times yeah maybe or partner no maybe you better so trusting enough but if you appear him the okay so you need to also sometimes
yes I also to be my back on so bia no pie there na okoye niam na adade na what there we all right but me person beside this question we say for clarification ebinum esore a wakoya de ne so wonka o say agana bia me course na ma me kwete ye eno so nsem te say cause ya na ebinum de dada o timi sa de wakoyo so say menyo e agana bia me course
like they can be there no so we dey in according show do show I can't speak elsewise for the
and you could near me wa can answer no question we say answer na dia mo na wa say wakoyo na so wonyo
preventive measure no measure say when people are mating with their partners, you know, they possible or more having it under the light. So, boy, no man, or when you know, but if you're sharing a hookup nana on any having
one night stand.
Yeah, on any having intercourse. Meanwhile, on the body in the crib, you can rashes be and also when you have those words and herpes no. But because more having sex in the dark and it's not.
Yo, Mate, now your date. That's why there's what I say. Now your date in the car. No, I say, yeah, have it in the light. Light now work and yes, so light first so. Was this a hook up? No one night stand. The entity so, yanky castle, entity in San Jose just living. Bema ya na sometimes you see trade sex bibi wona be hu de ye hu yes ready mu akono ni tin wa bo awure wo be wie kire nurse watete enema honya beberebe na hu de aye ho enti tete enema so sa round so na we say master stick to one partner ja rough no hey woni na what you say
what they want nobody for touch but she know the phone quick self-made what the challenge but she do well paid on the boy she looking for help mate cause she know the suffer from sulfate and when you are hell late.
At the same time, no, so no, send a miss me the bet to also area man and say, Mua yana sometimes moko party as ya in Sanom and Sanom, who are branch be a who say yes, or a come master to mamma no. One she and at the end of the day was sad wire then afro nempa, into making sure say and San Upia Bontia. When in what you say, see Canada Obergio, Nansono, a chirasa, Yaredia, who. One shana went to me and the NCA come Yanka is a sem, Shadana Manka is a sem. It sounds always Sibiana. We think, say, STDs no, it's all about HIV is. HIV is the account was my house road. Now, since Simbo Mayana wounds, and then I'm a bopia when I'm there, they do too. Thank you so much. Sweet Naya date, Medawase, send that over studio my to change and come on. We are wrapping up on the show. Yeah, did you make any air banner? Bopia, sweet Naya date. Yanin 18 come out to change and above the mom who said. STDs no ya na ebinim ya frakada mu nsembu ho nom entia ma wani na ho na me de okan ya na eya me depa ni say we shouldn't have it in the dark masa ye ne han mu ati ase eni kwan say obo pia ni pakro no one stand na udin da krope na sikanti o da range mu Corolla nti no akodi ahye ho obaji asaje yare no mu ani na ati ase the name is still Bismarck Kwame Apia Synergy what I say on the streets, catch me same time each and every day. Thank you anytime, any day.